Welcome to the Pottstown Area Health and Wellness Foundation's webisode series on the opioid crisis. I'm your host, Beth Trapani, and in this episode, Real Solutions Matter. We're talking about some of the county-wide government solutions to the opioid crisis. My guest today is Dr. Valerie Arkoosh, the chair of the Montgomery County Commissioners. Thanks so much for joining us.
Thank you, Beth.
And tell us, what is the county doing? I know it's an awful lot.
Well, the county's been very involved in this crisis since about the fall of 2014. Interestingly, some police officers came to the then county commissioners and said that they'd been noticing just a very unusually high number of people dying from opioid overdose, and they asked the county to look into it. So the county formed a task force that fall of 2014. That task force was made up of people from the community, members of our drug and alcohol department, our behavioral health department, law enforcement. It was a real wonderful convening of different stakeholders. And they produced a report in early 2015. And that report has guided much of the work that has followed since. But the county has also really played the role of looking at what can we do as the government agency for the entire county to pull all of our communities together. We have 62 municipalities in Montgomery County affected by this disease. Coordinate our efforts, disseminate information countywide, really help educate the public, and make treatment resources available to everyone.
You have an extensive background in public health. If you can tell me briefly about that, and then talk about how do you go about educating people, because this is a very pervasive problem that affects people of all ages and socioeconomic brackets.
So my background is a little unusual for an elected official. I am a physician. I practiced medicine for a little over 20 years before I decided to go back to school and get a degree in public health. And fortunately, those two backgrounds have been incredibly useful in attacking this epidemic. The epidemic is countywide. And one of the most important things that I do from my unique background is remind people that substance use disorder is a disease. It's no different than any chronic, lifelong disease like high blood pressure or diabetes. It can be treated, but it requires ongoing treatment for the rest of someone's life. And people will have relapses. Just like every once in a while someone with diabetes goes out and gets an ice cream cone, which may not be the smartest thing for them, you can see relapses with a substance use disorder as well. So decreasing the stigma around this is not about a moral failing or bad parenting. This truly is a disease with a big genetic predisposition to it. Just getting that message out is very helpful.
Okay, terrific. How about some local treatment resources?
Well, we have many. A couple of the steps that the county has taken has been to make a medication called Narcan widely available. That medication can reverse the effects of an opioid overdose, literally restoring someone back to life. We have every police officer in Montgomery County carrying this medication. We have something called a standing order in our county, so people can walk into most pharmacies in the county and just go up to the desk and say they would like a prescription of Narcan, and they can get that without having to call their own doctor. They will have to pay for it. They will bill insurance if you have insurance. If you don't have insurance, we do have some doses available at no cost through the county's health department. And then we also do public education with Narcan and give it away at those events. We do that 4 times a year. We've worked with our local high schools and our 22 colleges and universities across the county to help educate both teachers, faculty, students, and most of those institutions all now have Narcan on site. So we do a lot of preventive work, helping people understand where this disease comes from, that there are ways to treat it. And then one of the most important roles that the county plays is actually connecting individuals who want to go into treatment to treatment.
Is it possible that someone might know someone who has an opioid addiction and not even realize it? Is it possible to hide it?
Absolutely. If you look at the data from our county, and we have some great online resources at montcopa.org/overdose prevention, you can see maps where people have overdosed, where police or EMS have given Narcan, and you can see that this is a disease, like most diseases. Doesn't care what color you are, doesn't care how much money you make, it doesn't care the zip code that you live in. It is literally everywhere in our community.
And that gets back to, as you were saying, there tends to be such a stigma around the word addiction. And I guess what's unique about this one is someone can become addicted without even realizing that that's happening.
Well, I think what we saw happen was in the kind of late 90s, early 2000s, there were some new opioid medications that came on the market. People are probably familiar with one of them, OxyContin. And there was a sense, because of the way those tablets were formulated, that they would be less addicting than prior forms of opioid medications. And so doctors prescribed them. At the same time, there were a lot of those patient satisfaction scores that are really being promoted. And so patients were always asked, how well did your doctor treat your pain? So I think there became a almost over-reliance on these medications, and people were very quick to prescribe them. And rather than giving someone maybe 3 days worth after a surgery, which would probably be sufficient for most people, they were given a month's worth. And so people had all these medications sitting in their cabinet, and they thought, oh, well, it must be okay. My doctor prescribed them for me. And then if a person has that predisposition, they could easily end up finding themselves with a problem.
Terrific. Thank you for your time. We have lots of resources on our screen. The website that you referenced, the Montgomery County website, and also we have a crisis line for someone to call if they have an urgent crisis. And for more information on this, more webisodes, we would like to refer you to the Pottstown Foundation.org.